Just a quick overview. I trained in India. I did my MBBS from All India Institute, did my MD gynecology here, and then went to the US and was fortunate to get when I had to retrain, to be at Henry Ford Hospital, where Dr. Mani Menon was pioneering robotic prostatectomy. So we started doing robotic surgery way back in 2003 because Henry Ford had a robot, and urology was very kind enough to let gynecology use it. There was always this stir force going on. So I have been here about 2 years back. So this has been a 2-year period for me for proctoring here. I do proctor for Intuitive in the US too. I'm the residency program director at Henry Ford Hospital, and we have a 2-year robotic and minimally invasive fellowship. So that being said, I'm used to teaching. That's my new role, and I really welcome that. It's always a pleasure to be in India. I'm really excited about the work that is being done here. We're among an elite group of surgeons. I know you're mostly urologists. I do see a smattering of gynecologists too. And just to, I won't take too much of your time, just some little stuff that I was listening to. My first thing would be, as surgeons, I've seen now you have your teams developed. Every hospital is very vested into the training experience. Vatakuti is investing a lot into providing you the right resources and the adequate training, because training is really important. We are seeing a spate of lawsuits in the US related to the robot, and Intuitive being going into lawsuits because people feel that training wasn't adequate and they started using the robot. But I don't see that as the case here with all the investment with the hospital and the foundation that's going on. Couple of things as I was listening to people speak was, one was about, just about robot, was loss of haptics. As you keep on doing it more and more, and I've been proctoring cases, your haptics is going to be replaced by your visual feel. So I still say I can feel with the robot. It's how you see the suture breaking, the tension on the knot, your instruments moving back and forth. And so you will be able to get that back once you have more and more experience. The second was, you talked about, Dr. Prasad, was ergonomics. I think if you take the patient and you do everything from A to Z for the patient, including positioning your patient, putting in your ports, and docking your robot yourself, you will find that, sometimes what doesn't work for you, what works for you, and you can change that. But please be invested into learning how to do the whole procedure, not just sitting on the console, because sitting on the console is the easiest part, trust me. It's setting up the patient and the ports for the right way. If that's not set up the right way, you would be having a really tough time on the console to complete your surgery. So in order to make your surgery a success, to be more efficient in the OR, please learn, invest your time to learn all the steps of the procedure. So that would make you a more efficient and successful surgeon, and that would give you more and more impetus to, attempt more complicated surgeries and get you to be more confident in your case. I'm also seeing that you have very good OR teams now, so that is very good. And even surgeons have formed their own robotic teams where, they have 2 partners and people are partnering with each other. That's always helpful. You may have in your, as speaking with proctoring gynecologist, if you have people in your hospital who are doing more robotic surgery, whether it's the general surgeon or the urologist, please ask them to step into your OR and see, if you're having problems with instruments clashing or something else, to see what's working and not working for you. We in gynecology prefer always parallel or side docking, because that helps us with uterine manipulation. So if you have a urologist or someone else come in and you start doing docking from the front, don't do that. Use your side dockings, but you could always learn tips and tricks from your colleagues and make it a collaborative effort at your institute. Couple of other things, before you start, you go for your surgery the next day, you have a robotic case, view a couple of videos beforehand at night. It always helps. Sit and do some simulation right before you do your surgery, because what I'm finding is you're not having a volume of cases bunched together. So you do one random case now, another one maybe a week or so later, maybe a month later, so that you lose your skill set. In order to keep your skill set, you need to have repetitive experience and more volume. So in order to compensate for that, view some videos the night before, do some simulation, practice your suturing, do a mental imagery, kind of think of how you want your OR set up, where your camera is going to be, where your ports are going to be, so you're not kind of struggling and getting frustrated in the operating room. Also, what we routinely do is we videotape all our surgeries, and then we view them with our trainees, whether they are residents or our fellows, after the procedure, and kind of, you could do that on your own to see what worked, what didn't work for you, where your instruments were clashing, you know, all that kind of stuff. So it's really good to view your own videos and see what you could have done better. The other thing that we always do is we kind of do a huddle with the team after you finish the surgery. Just take 5 minutes, sit down with your team, whether it's your circulator, you know, your scrub tech, your assistant, and say what worked, what didn't work, what we could have done better, because they may be able to give you some feedback from the bedside assistants and say, you know, we found it really hard to do this or do something different. So that always works. So I have nothing much to say except that it's been really exciting, a lot of investment. Please continue to gain on that experience that you have. Practice more, use a simulator, and I wish you all the best, and I'm sure when I get back you'll be doing more and more exciting work. Thank you for your time.
Good. Thank you, Roopina, and you are a witness. You were there in VGR 2012, and it was a very, very minimal presence of Indian component, and the way it is growing, I think there are 48 people actively involved in robotic surgery. And Raj always aims at very high. He says that he wants 400 surgeons of Indian origin doing more than 100 surgeries. That sets a very tall order for us.